Our community health improvement plan actually came out of our data that was collected for the 2014 Missoula County Community Health Assessment. And in that health assessment, we were looking at lots of health data that affects the community and kind of where we stand in comparison to state and national trends as well. And that was a collaborative effort that was the health department and a lot of other organizations within the community that all care about, the health of our community. And a couple of the things that came very clear as we were going through the community health assessment process was that there were a couple of priority areas that a lot of us are working on, but we're not necessarily working together. And so that's how the community health improvement plan came in, is that basically, the two areas are access to care and obesity, and we want to be able to work together and kind of pool some of our resources and make sure that we're not duplicating each other's work so that we can have a real collaborative effort to tackling these two health issues.
So how are you doing that?
Well, we met for about 9 months and talked about what each one of our organizations was doing on these issues. We had two separate groups, one for access to care, which involved enrollment in coverage plans and Medicaid expansion, the Affordable Care Act enrollment period, universal public health home visiting services, community suicide prevention training, and then in our obesity prevention group, we were looking at prescription trails, planning for bikers and walkers, looking at obesity prevention across the ages, so childhood obesity, adult obesity, and older adult obesity. And we basically just met in groups and talked about what each one of our organizations were doing and how we could work together, and came up with a work plan that we'll be working on for the next 3 years.
Okay, so how does the public take advantage of this collaboration, Cindy?
Well, basically, we are hoping that what's going to come out of this and the way that it will be beneficial to the public is that you could talk to your healthcare provider about, obesity concerns, and they would be aware of some of the things that are happening within our obesity prevention group and some of those interventions, so they can talk to you about prescription trails, or they can talk to you about ways to improve your nutrition. And they would know then who would be really great people to refer you to. And as far as access to care stuff, then we're hoping that means that you can ask a lot of people in the community, and they'll know who's working on this.